This is Tom Suspenski back again at Health Check Physical Therapy, and I'm here to talk to you about the third cause that I often see, which is a SI joint, which is sacroiliac joint malalignment in the pelvis. And also, along with that, people might have old disc problems. They might have an old bulge, an old herniation that's degenerated. They might have the degenerative disc disease that I was talking about. But generally, people that come in, they'll either have pain standing or sitting, and a lot of them talk about my leg seems a little bit long or my leg seems short, and we look at the pelvis and actually see that the pelvis is out of alignment and we have to correct it. And it's really very synonymous to looking at your foundation in your house. If the foundation is out of position, you're going to have cracks up the wall. Well, the same thing happens in the spine. This is an example of the spine, and this is the back of the spine, and this is your right pelvis and your left pelvis, and then this is the sacrum. And when that hip rotates forward, it brings the hip socket closer to the ground, so it makes the leg apparently longer. So that changes the pressures along here and puts more pressure on the discs. That's where they have pain with standing. If they have pain with sitting, this is generally rotated backwards. And we know how to correct that with manual therapy techniques. And we also know what to do to strengthen the core, which is the abdominals, the muscles around the hip, the butt, and ways of kind of stabilizing that area so it stays where it should stay. And that's how we basically treat it. We have very good success with that. We also look for things like weakness in the leg. We look for reflex losses, and we also look for sensory problems, whether they have numbness or not. We determine that if people don't have a lot of those kind of symptoms, then they don't really need an MRI. So if you're looking to find out why you have pain, give us a call. We'd be glad to take a look at this. Our number is 610-269-5070. And thanks for listening.